Today, little Sally is here waiting to find out the results of her fast plasma glucose test. This is most commonly used test in diagnosing diabetes. She hasn't eaten or drank anything for 8 hours. Now her blood is drawn and the glucose concentration is determined. If her glucose values are greater than 100 milligrams per deciliter, she will be diagnosed with diabetes mellitus.
Hiya, Sport. How you doing today?
Not the best. I'm tired, thirsty, hungry, can't stop peeing, keep losing weight for no reason, keep getting infections, the cut on my hand won't heal, I'm agitated, and my vision is blurred.
Gee whiz, that's a lot of symptoms. The results of your fast plasma glucose test show that your blood glucose levels were 156 milligrams over DL and 144 milligrams over DL. These are pretty high. Looks like you might have diabetes. Let's run a few more tests, shall we?
Dr. Tickles will now do an oral glucose test. This requires Sally to consume a drink containing 75 milliliters of sugar.
Looks like your glucose level is 200 mg over DL and that you have type 1 diabetes. I could also use a glycosylated hemoglobin test, which tracks your glucose level over the last 120 days, the average lifespan of a red blood cell. But the other two tests are significant enough to conclude you have diabetes.
Oh no! How did I get such a scary disorder?
The cause of type 1 diabetes can be family inheritance, an injury to the pancreas, or other environmental factors, like an infection. Usually the exact cause is unknown. But don't feel special. You're 1 in 25.8 million people in the U.S. with diabetes. That's 8.3% of the population. However, your case is a bit more rare. Of everyone with diabetes, 95% of the people have type 2.
How do you know if I have type 1 or 2?
I would like to take this brief pause to explain the differences in type 1 and type 2 diabetes mellitus. In type 1, your immune system destroys insulin-producing beta cells of the pancreas. The reason for their attack has not yet been discovered, but the result is insulin deficiency. Type 2, the more common kind, occurs when the body doesn't produce insulin or is no longer sensitive to the hormone.
Wait, what's insulin?
Great question, Sally. Insulin is a hormone released by clusters of beta cells in the pancreas called islets of Langerhans. It is triggered by a rise in glucose levels and uptake by the GLUT2 transporter of beta cells. This uptake increases the ATP-ADP ratio in the cells by glycolytic phosphorylation. When the ratio has increased, it activates the potassium channel, depolarizes the membrane, and causes the calcium channel to open up. It is this increase in calcium levels that leads to the release of insulin. Once insulin is released, it diffuses into the bloodstream and is transported to the skeletal and adipose tissue cells. Here, it combines with the insulin receptors in the cell membrane. These insulin receptors recruit membrane vesicles containing GLUT4 glucose transporters. These vesicles merge with the cell membrane, allowing for the transport of glucose into fat and muscle cells. When insulin is inhibited by either insensitivity of the receptors, like in type 2 diabetes, or is not released due to the destruction of beta cells, as in type 1 diabetes, sugar builds up in the blood while the body's cells starve. This is what we are testing for in the oral glucose tolerance test and fast plasma glucose test. Now that we understand the mechanism of diabetes, let's explain the answer to Sally's question about the differences between type 1 and type 2 diabetes a little better. In type 2, insulin is produced, but is not able to bind to the receptor and be properly processed by the body. In type 1 diabetes, the body destroys the islet of Langerhans cells, so insulin is not produced. Both of the types of diabetes result in a reduced number of GLUT4 transporters and the starvation of the body's cells. Type 2 is usually a result of obesity and old age. It is more prevalent in certain ethnic backgrounds, such as Hispanics, Latinos, African Americans, and Native Americans. You are at an increased risk if you have high blood pressure or live a sedentary lifestyle. Luckily, the treatment for this is fairly simple. Reducing weight, going on a diabetic diet, and exercise can greatly reduce the severity. In some cases, it can completely get rid of it. If these methods fail, there are oral medications that can increase the body's sensitivity to this hormone. Insulin injections are used as a last resort.
How informational! Dr. Giggles, will you tell me about type 1?
Course, champ. That's what I'm here for. Well, unfortunately, type 1 diabetes is a lifelong disorder with no known cure. Strict control of glucose and insulin treatments can prevent or at least delay complications with your eyes, kidneys, nervous system, and heart. But this is not foolproof.
To control my glucose level, do I have to use one of those finger pricking tests to check my glucose level?
You sure do. Along with monitoring your blood glucose level, you'll need to take insulin and maintain a healthy lifestyle. This means eating healthy, exercising, and maintaining healthy weight.
And now it's time for some eye clicker questions. What's the most common diagnosis test? A. Oral glucose tolerance test. B. Fast plasma glucose test. C. Glycosylated hemoglobin test. Which type can be cured? A. Type 1. B. Type 2. Which isn't a symptom of diabetes? A. Blurred vision. B. Excessive thirst. C. Weight gain. What is insulin's main function? A. Regulate uptake of glucose into cells. B. Excretion of glucose in urine. C. Digestion of lipids. In type 1 diabetes, the insulin is deficient because A. It is not produced in high enough quantities. B. Destruction of pancreatic beta cells. C. The pancreas produces an alternative, ineffective hormone. D. It's not deficient. The body does not recognize it.
Here we are at the end. Say goodbye to all your friends.